Joining us now for a healthy debate are Democratic Congressman Peter Welch and Republican Congressman Darrell Issa. We're going to start on the Democratic side. Congressman Welch, thanks for being with us. On the forefront of this health care reform bill that Speaker Pelosi introduced yesterday, of course, is the potential cost, $1 trillion and higher. What are your constituents saying to you about their concerns about the cost of health care?
Well, what they're telling me is health care is hard to fix, but it's got to be fixed. And in fact, many of my businesses, small businesses and large businesses, are saying that the escalation in the cost of health care, rising 2 to 3 times the rate of inflation, wage growth, or profits, is killing them, and that's a job killer. So they are telling me that we've got to fix it, and what they want is 2 things. Number one, the security and peace of mind they're going to be able to choose their doctor, that they're going to be able to maintain coverage, that they won't be denied coverage because of a pre-existing condition. And the insurance reform provisions in the bill do that. And secondly, they want it to be affordable. So I think that we're on the right track, but if we have work to do, it is going to be on that cost side, because we have to reward value, not volume, which is what we're getting now with the fee-for-service-driven system.
What does that mean, though? And I saw that in the initiatives that were in the bill that Speaker Pelosi introduced yesterday. I saw that all of your initiatives were included, but what does that mean when you say that? Can you be more specific, sir?
Well, I can. You know, you have places like the Mayo Clinic in Geisinger and even some of our practices in Vermont where you give a practice, like a hospital group that has all of the various providers that you may need for your chronic care, illness. You give them some benefit when they come in achieving savings. So if you save 5%, they actually get an increase in share in the savings of 3% because they used standards to provide care according to what was necessary as opposed to the incentive they get from fee-for-service. So that's an approach that has to be part of this equation, because if we don't bring the cost down, no matter who pays for it or no matter how we pay for it, it's not going to be sustainable. And, you know, it looks like there'll probably be a partisan divide on this, Democrat and Republican. But the next 5 days we'll be marking up in the Commerce Committee. And my invitation to my Republican colleagues is give us your good ideas on the cost side. So even if this is a bill that you're going to vote against, we've got to fix this system and give us a better bill. Help us make it a better bill, especially on the cost side, because that's the relief that our businesses need, small businesses and large businesses.
Yeah, and Congressman, you know that a lot of people, the surveys are getting back to you. People are concerned about the massive deficit and the fact that it's growing so quickly, and they're concerned if this doesn't get through the Senate, let alone the House, is the fallback position to maybe just focus on a plan for that 40-some million that we always hear about that are uninsured, instead of the rest of us who have health insurance, whether we like it a little or a lot, we have it?
Well, 2 things. Number one, the bill is paid for, so it's not adding to the deficit. You know, we've got to wrestle with how do we pay for it, but it is paid for. That's number one. Number two, if you don't address the uninsured, then what we do is aggravate the cost shift. Because, you know, the premiums that you pay, that your employer pays, those are inflated because embedded into them is the cost of providing the free care to folks who show up at the hospital without any coverage. In Vermont, and I'm sure in many places around the country, somebody without care shows up in the emergency room, the hospital, the doctor, they're going to take care of them. But there is a cost to that, and it gets added on to the premium you pay. That's not right. That's the cost shift, and that's one of the things we want to do is give some relief to the middle class and to our employers who are really paying the difference right now for uncompensated care.
All right. Well, Congressman Peter Welch, I'm going to have to let you go. We've got some breaking news on a titan in business, but thank you, sir, for coming on Fox Business.